Hello, and thank you for joining us for this Clackamas County update for the week of November 30th, 2020. I'm Kimberly Dinwiddie, the county's Public Information Officer. What should you do if you catch COVID-19? Or if you find out that you've been in close contact with someone who has it? Today I'm speaking with Clackamas County's Public Health Director, Philip Mason Joyner, to tell us what to do next. Welcome, Philip.
Hi, Kimberly. Thanks.
So if I find out I have COVID-19, what should I do?
If you have symptoms or were exposed to someone who has tested positive for COVID-19, it's really important that you contact your healthcare provider and discuss getting tested. While you're waiting on your results, you need to quarantine. So what this means is you need to stay home and you need to stay away from others. Once you get your test results back, if you test negative, please follow any of the instructions that your healthcare provider gives to you. Even if you've tested negative, if you have been around someone with COVID-19, you may still need to stay home and away from others. You need to quarantine, and typically that's up to 14 days from when you were exposed. You should also continue everyday measures in order to protect yourself and others. If you test positive, whether or not you have symptoms, you still need to stay home and separate yourself from others for at least 10 days after you receive those test results. And what we call this is isolation or isolating. If you're still experiencing symptoms after your initial 10 days of isolation, you may need to continue to isolate for a longer period of time until your symptoms are gone. Our public health guidance recommends that you stay away from others at least 24 days after you are no longer experiencing any symptoms.
Wow, that's a lot of information. We've posted a guide online for you at clackamas.us/coronavirus/testing. It's available in both English and Spanish. So Philip, what should I do when I find out I've been in close contact with someone who has tested positive for COVID-19?
Sure. If you've been in close contact, then that means you need to quarantine. And close contact, definition of that is that you were within 6 feet of someone who has COVID-19 for at least 15 minutes, regardless of if you were wearing a mask or if you were outside. While those are great tools to help reduce the risk from COVID-19, it doesn't make you exempt. You'd still be considered a close contact. You would still need to quarantine if you've been exposed, and if you begin to experiencing symptoms, you need to isolate.
This situation has gotten a lot worse, hasn't it?
It has right now. We were, with the change in weather and folks having to gather indoors a lot more frequently, as anticipating, we're seeing increases in cases around the region and here in Clackamas County. We're really concerned about our healthcare workers, and our public health system is getting overwhelmed. This means we have to really prioritize and focus our contact tracing efforts on those that are highest risk from severe illness. At this time, because of the surge in cases, we really need the community's help us to take even more responsibility in protecting ourselves, our family, our friends, and our coworkers if we get sick.
So we should really be keeping our guard up.
Absolutely. Something else that individuals who test positive for COVID-19 can do to help us out a whole lot would be to make a list of all the people that you've come into close contact with. These should be the people you've interacted with starting about 2 days before you had symptoms, and tell your employer if you have coworkers who are on that list. This will really help to expedite our contact tracing efforts as we work together as a community to reduce the spread from COVID-19.
Thank you, Philip. And thank you for joining us. Please stay safe, and we will see you next week.